Cerebral palsy. Introduction. Cerebral palsy, sometimes called Little's disease, is a broad medical term which covers a range of the conditions, all resulting in some form of paralysis in early infancy because of imperfect development of or damage to the nerve centers in the brain. The term cerebral palsy serves useful purposes, although the term encompasses many different conditions that include some specific criteria. The pathology is in the brain. There is a motor disorder. The disorder is not progressive, and the etiologic insult occurred before birth, in the perinatal period, or during the first few years of life. Definition. Cerebral palsy refers to a group of conditions which share the features of central motor deficit, which is non-progressive pathologically and which is acquired in early life. Etiology. Cerebral palsy can be caused by anomalies resulting from abnormal implantation of the ovum or fetus, maternal diseases, threatened miscarriage, external toxins, or metabolic disorders. The single most frequent factor associated with CP is birth weight below 2500 grams, which may occur in premature delivery, small for gestational age, infants, or multiple births. All complication of the childbirth, including abruptio placenta, prolapsed umbilical cord, and complicated breech deliveries. The predisposed to hypoxia or intracranial bleeding in the neonate. The infections and trauma are the chief causes of CP in the postnatal period. Pathology. Because CP is not a single clinical entity, and because many etiologic factors may cause these syndromes or contribute to, then there is no single pathology. The findings depend primarily germinal layer and intraventricular hemorrhage or periventricular leukomalacia in preterm infant, and ischemic brain damage in the birth asphyxiated child. Classification. There are three major types of the CP: spastic, dyskinetic, and ataxic. Combination of two or rarely three types may occur. Types: spastic hemiparesis, tetraparesis, dysplasia, diparesis, hypertonic, hypotonic, paraparesis, mono and triparesis, dyskinetic, athetosis or other dyskinesias, ataxic, mixed. Course. By definition, CP is not progressive, although the clinical manifestations may change. The untreated spastic child may develop fixed deformities due to non-uses of muscles and joints. Some walking patients become non-ambulatory if they gain too much weight because the energy required for walking becomes prohibitive. Diagnosis. These patients are usually younger, between 5 and 14, and they present specifically for evaluation of their movements. The movements are usually precipitated by startle or movement and often are not preceded by a sensory aura. Prevalence. Most survey give a prevalence of excuse me, cerebral palsy is in the order of 2 per thousand according to Stanley and Elberman 1984. Treatment. CP cannot be cured. However, functions can be improved in the almost all cases, especially when treatment starts early. There is no standard therapy. The physician must recommend what is best for each individual patient at a particular time and the age. The goals of therapy are to improve the functions, control seizures, select the most suitable time and place of education, and help the patient to establish excuse me, an emotional life that approaches normal. Treatment includes physical and the occupational therapy, speech therapy, and use of orthosis. Surgery may be indicated when specific goals cannot be obtained by other means and when a particular surgical procedure cannot be expected to improve functions. In all forms of therapy, the family or other caretaker should be intimately involved. The physician who first recognizes the CP in the child and the professionals who treat the patient must begin to help the family early and continue helping them to adjust thereafter. The child's adjustment follows in certain periods, especially during the puberty and the sexual awakening, individual psychotherapy and guidance are helpful. Care. Parents will expect a baby to be dependent in all aspects excuse me, of everyday care. The baby with cerebral palsy, however, may be particularly difficult to care for, making considerable demands on her parents' time and skill. The difficulty of failure in meeting a baby's basic everyday needs can undermine parents' confidence in their present skills. Everyday care routines such changing, bathing, feeding, and dressing are also important contact times for parents and the child. The availability of the advice, support, and aids from an early stage can help to promote more relaxed and the positive contact between a parent and a child with a cerebral palsy and enable the parents to remain confident and in control of their child. So thank you very much for watching the video.